It's something many men experience but often don't talk about. You might feel like you're hitting a wall, that things just aren't working the way they used to. Maybe it started subtly, a little less reliable here and there, and now it's become a real source of frustration, even worry. It affects your confidence, your connection with your partner, and honestly, it can just feel like another reminder that things are changing as you get older. And while age does play a role in many things, sometimes the challenges you face with getting or keeping an erection aren't just about getting older. There might be something else going on, something often overlooked, hiding in plain sight. The painful reality is that many men suffer in silence, feeling like it's inevitable, or there's nothing that can be done, or worse, that there's something fundamentally wrong with them. But what if a part of the problem, perhaps even a significant part, is coming from somewhere you least expect? What if something you take regularly, something prescribed by your doctor to help another part of your health, is actually making things more difficult downstairs? It sounds counterintuitive, I know. We trust our medications to help us, and they absolutely do in so many ways. But like anything powerful, they can sometimes have unintended side effects. And some very common medications, ones millions of men over 60 take every single day, can unfortunately impact your ability to get and maintain an erection. These aren't obscure drugs. They might be sitting in your medicine cabinet right now. In this video, we are going to uncover 5 types of common medications that could be silently contributing to this problem without you even realizing it. Understanding this connection is the first step, and it's a crucial conversation to have with your doctor. Knowing what to look for, what questions to ask, can make all the difference. We'll explore how these medications work, why they might affect erections, and what you can potentially do about it. This isn't about telling you to stop taking any medication. Absolutely not. It's about empowering you with information so you can have an informed discussion with your healthcare provider. Stay with me because by the end of this, you might see your health in a slightly different light. And there's something I'll share that might genuinely surprise you. Let's dive right into this important topic, starting with the first type of medication that frequently comes up when we talk about unexpected causes of erectile difficulties. We're talking about certain blood pressure medications. Now, many men over 60 take medication to manage high blood pressure, and for good reason. Keeping your blood pressure under control is vital for preventing serious issues like heart attacks and strokes. These medications are literally lifesavers for millions. However, some classes of blood pressure drugs, while doing their job of lowering blood pressure, can unfortunately have an impact on erectile function. Think about it. An erection relies heavily on healthy blood flow. Anything that interferes with the complex process of blood vessels expanding and contracting, or with the nerve signals involved, can potentially cause problems. One class of blood pressure medication commonly associated with erectile dysfunction is called beta blockers. You might know them under brand names, but generally, they are prescribed for things like high blood pressure, chest pain, angina, and even certain heart rhythm problems. How do they work? Well, in simple terms, beta blockers block the effects of certain hormones like adrenaline. This slows down your heart rate and reduces the force with which your heart pumps blood, thereby lowering blood pressure. It's a very effective way to reduce strain on your heart and blood vessels. But here's where the unintended side effect can come in. The same processes that regulate blood flow and muscle contraction throughout your body are involved in getting an erection. Beta blockers can sometimes impact the ability of the blood vessels in the penis to relax and expand properly in response to sexual stimulation. This relaxation and expansion are essential for allowing blood to rush into the penis, which is what creates rigidity. By potentially interfering with these signals and blood vessel responses, beta blockers can make it harder to achieve or maintain an erection firm enough for intercourse. It's not every man on beta blockers, and it's not every beta blocker that has the same degree of impact. Some of the older types of beta blockers are more often linked to erectile issues than newer ones, or those that are more selective in how they act on the body. But it is a known potential side effect, and one that is often overlooked because the focus is rightly on the life-saving benefit of controlling blood pressure. A man might start a beta blocker and months later begin experiencing problems with erections, and he or his doctor might not immediately connect the two, attributing it instead to age or other factors. Another type of blood pressure medication that can sometimes cause issues are diuretics, sometimes called water pills. These medications help your kidneys remove excess salt and water from your body, which reduces the volume of blood flowing through your vessels and lowers blood pressure. They are also very common, especially in older adults. While generally well tolerated, some diuretics, particularly thiazide diuretics, have been linked to erectile dysfunction. The exact mechanism isn't always fully understood, but it's thought that they might affect blood flow or even impact zinc levels in the body, which plays a role in male sexual health. They can also sometimes cause a decrease in libido, or sex drive, which is a separate but related issue that can affect intimacy. Similar to beta blockers, it's not a guarantee that you'll experience this side effect, and the effect can vary depending on the specific diuretic and the individual taking it. Again, the benefit of managing blood pressure with a diuretic is usually far greater than the risk of this side effect, but it's information you should be aware of if you are taking one of these medications and experiencing difficulties. So, if you are taking a beta blocker or a diuretic for high blood pressure or a related condition and have noticed a change in your erectile function, don't panic. The first and most important step is to recognize that this could be a contributing factor. The next step is to talk to your doctor. They might be able to switch you to a different type of blood pressure medication that is less likely to cause this side effect. There are many classes of blood pressure drugs available, and they work in different ways. For instance, ACE inhibitors, ARBs, angiotensin II receptor blockers, and calcium channel blockers are other common types of blood pressure medications that are often less likely to cause erectile dysfunction than beta blockers or some diuretics, although they can have other side effects. Your doctor can assess your individual health needs, the severity of your blood pressure, and consider alternative medications that control your blood pressure effectively while potentially improving or resolving the erectile issues. They might also consider adjusting the dose of your current medication. Sometimes a lower dose is still effective for controlling blood pressure and might reduce the side effect. The key takeaway here is that while beta blockers and diuretics are incredibly useful and common medications, they are known potential culprits for erectile problems, and it's a conversation worth having with your doctor. Do not, under any circumstances, stop taking your blood pressure medication without consulting your doctor. Suddenly stopping these medications can be very dangerous and lead to serious health consequences. Your doctor is the only one who can safely guide you on managing your blood pressure and addressing any side effects you might be experiencing, including those impacting your sexual health. Open communication is vital. Explain exactly what you're experiencing and when it started. This information helps your doctor understand if it's potentially linked to a new medication or a change in dose. Now that we've covered some common blood pressure medications, let's move on to another area where medications can sometimes have unintended effects on erectile function. Moving on from blood pressure medications, another group of drugs that can silently affect erections are those used to treat depression, anxiety, and other mental health conditions. This might seem less obvious than medications affecting blood flow, but the connection is significant. The brain plays a crucial role in the process of sexual arousal and function. Hormones, neurotransmitters, and nerve signals originating in the brain are all involved in initiating and coordinating an erection. Medications that alter brain chemistry, even to help improve mood or reduce anxiety, can sometimes interfere with these signals. Antidepressants are a prime example. Different types of antidepressants work in different ways, but many affect levels of chemicals like serotonin, norepinephrine, and dopamine in the brain. While beneficial for alleviating symptoms of depression and anxiety, these changes in neurotransmitter levels can sometimes dampen sexual desire, make it harder to become aroused, or interfere with the physical ability to achieve or maintain an erection. A very common class of antidepressants called SSRIs, or selective serotonin reuptake inhibitors, are particularly known for this potential side effect. These include medications you might recognize like sertraline, fluoxetine, paroxetine, and citalopram. They work by increasing serotonin levels in the brain, which can help regulate mood. However, elevated serotonin can also affect sexual function. The specific impact can vary widely from person to person and depending on the specific SSRI used. Some men experience a reduced libido, others have difficulty achieving orgasm, and many report problems with erections. It's one of the most common reasons people stop taking their antidepressants, which can be detrimental to their mental health if not managed properly. It's a difficult balance. The medication is helping with mood, but negatively impacting another important area of life. Again, the key is awareness and communication. If you've started an antidepressant and subsequently noticed changes in your sexual function, it's highly likely there's a connection. Just like with blood pressure medications, you should never stop taking an antidepressant cold turkey without talking to your doctor, as this can cause withdrawal symptoms and a return of depression or anxiety. Your doctor can discuss options. They might suggest trying a different antidepressant from a different class that has a lower risk of sexual side effects, or they might consider adding another medication to counteract the sexual side effects of the current one. Sometimes, adjusting the timing of the dose can help, or in some cases, if the depression or anxiety is well managed, they might explore whether a lower dose is appropriate. The important thing is to be open with your doctor about this. Many people feel embarrassed to discuss sexual side effects, but healthcare providers are very used to hearing about this and are equipped to help you find solutions that work for both your mental health and your sexual well-being. Beyond SSRIs, other types of antidepressants and medications for mental health can also have similar effects. Tricyclic antidepressants, an older class, and certain anti-anxiety medications can also potentially impact sexual function. The mechanisms vary, but they often involve effects on neurotransmitters, hormones, or nerve signaling. It's a complex interplay, and what affects one person might not affect another. The crucial message is that if you are taking any medication for depression, anxiety, bipolar disorder, or other mental health conditions, and are experiencing erectile difficulties, this medication is a very plausible suspect. It's not your fault. It's a known potential side effect, and there are often strategies your doctor can employ to help manage it without compromising your mental health treatment. Open that door to conversation with your healthcare provider. It could make a significant difference. Don't assume it's just stress or age. While those things can contribute, your medication might be a bigger piece of the puzzle than you realize. Now that we've explored how medications for blood pressure and mental health can play a role, let's turn our attention to a couple more common culprits you might not have considered. Carrying on, another category of medications that can unexpectedly affect erections are those used to treat certain digestive issues, specifically some medications for heartburn and acid reflux. Yes, you heard that right. Even medications for common stomach problems can sometimes have unintended effects on sexual function. We're specifically talking about a class of drugs called H2 blockers, or histamine 2 receptor antagonists. You might know some of these by common names like cimetidine or ranitidine. Though ranitidine has largely been withdrawn due to other concerns, cimetidine is still used, and other H2 blockers are available. These medications work by reducing the amount of acid produced by the stomach. They are very effective for treating conditions like gastroesophageal reflux disease, GERD, peptic ulcers, and indigestion. So, how could blocking stomach acid potentially lead to problems with erections? This side effect, while less common than with some blood pressure or antidepressant medications, is thought to be related to how these drugs can sometimes affect hormone levels, particularly testosterone, and potentially interfere with brain signaling involved in sexual function. Cimetidine, in particular, has been linked to a higher incidence of erectile dysfunction and decreased libido compared to other H2 blockers. It can, in some men, slightly increase levels of a hormone called prolactin and decrease testosterone levels, both of which can negatively impact sexual desire and function. While newer and more potent acid-reducing drugs like proton pump inhibitors, PPIs, are now more widely used, H2 blockers are still prescribed, and it's important to be aware of this potential, albeit less frequent, side effect. If you are taking an H2 blocker and have noticed difficulties with erections or a reduced sex drive, bring it up with your doctor. They might consider switching you to a different type of acid-reducing medication, or exploring other strategies to manage your digestive issues that don't carry this risk. Remember, the goal is always to manage your health conditions effectively, while minimizing unwanted side effects. Now let's talk about a class of medications used very commonly, especially as people get older, which can also pose a challenge to erectile function: opioid pain medications. These powerful drugs are prescribed for moderate to severe pain, such as pain after surgery, injury, or chronic conditions like arthritis or back pain. While essential for managing pain for many, especially when pain is severe, long-term use of opioid medications can have several side effects, including a significant impact on hormonal balance, which directly affects sexual function. Opioids, like morphine, oxycodone, hydrocodone, and tramadol, can suppress the production of testosterone in men. Testosterone is a key male sex hormone that plays a vital role in maintaining libido, energy levels, muscle mass, and yes, erectile function. When testosterone levels drop due to opioid use, it can lead to decreased sex drive, difficulty achieving erections, fatigue, and other symptoms. This is often referred to as opioid-induced androgen deficiency. This side effect is more common with long-term, chronic use of opioids, rather than short-term use for acute pain, but it's a very real issue for men who rely on these medications to manage persistent pain. Managing chronic pain is crucial for quality of life, but it's also important to be aware of the potential trade-offs and discuss them with your doctor. If you are on long-term opioid therapy and experiencing problems with erections or low libido, talk to your pain specialist or primary care doctor. They can assess your hormone levels and discuss strategies. This might involve exploring alternative pain management strategies that reduce or eliminate the need for opioids, such as physical therapy, non-opioid pain relievers, nerve blocks, or other interventions. If opioids are still necessary, they might consider testosterone replacement therapy to counteract the low testosterone levels, although this comes with its own set of considerations and potential side effects and needs careful monitoring. The conversation about pain management is complex, balancing relief from suffering with minimizing side effects. Knowing that your pain medication could be contributing to erectile difficulties is an important piece of information to bring to that discussion with your doctor, so you can work together to find the best possible approach for managing your pain and maintaining your quality of life, including sexual health. Finally, the fifth type of medication we need to discuss might come as a surprise to some, because it's not a drug taken for a specific illness, but rather a very common over-the-counter or prescription medication used for allergies, colds, and sleep issues. We're talking about certain antihistamines and medications with anticholinergic effects. Antihistamines are widely used to relieve symptoms of allergies like itching, sneezing, and runny nose. Older generation antihistamines, such as diphenhydramine, found in many over-the-counter sleep aids and allergy medications, are known for causing drowsiness, but they also have significant anticholinergic properties. This means they block the action of acetylcholine, a neurotransmitter involved in many bodily functions, including nerve signals in the brain and throughout the body. While useful for drying up nasal secretions or promoting sleep, blocking acetylcholine can also interfere with the nerve signals necessary for achieving an erection. Acetylcholine plays a role in the relaxation of smooth muscle in the penis, which is a critical step for blood flow during arousal. By interfering with this neurotransmitter, these medications can make it harder for the penile tissues to relax and allow blood engorgement. Medications used for other conditions can also have anticholinergic effects, and thus potentially impact erections. This includes some medications for bladder control, certain antispasmodics for gut issues, some muscle relaxants, and even some other types of antidepressants. It's the anticholinergic effect that is the common thread here. So, if you are taking something regularly for allergies, sleep, bladder issues, or even certain psychiatric medications, it's worth checking if it has significant anticholinergic properties, especially if you're experiencing erectile difficulties. You can ask your pharmacist or doctor about this. If it does, your doctor might suggest alternative treatments for your symptoms that don't have this effect. For instance, newer generation antihistamines are much less likely to cause these kinds of side effects because they have fewer anticholinergic properties and don't cross into the brain as readily. Similarly, there might be alternative treatments for bladder issues or other conditions that are less likely to impact sexual function. This is that surprising element I mentioned earlier. Many men wouldn't think that their allergy pill or sleep aid could be impacting their sexual performance, but it's a possibility worth exploring with your healthcare provider. It reinforces the point that you need to look at your entire medication list, including over-the-counter drugs and supplements, when trying to understand health issues like erectile dysfunction. So, we've covered how certain medications for high blood pressure, depression and anxiety, some digestive issues, chronic pain, and even allergies or sleep can potentially impact your ability to get and keep an erection. It might seem like a lot to take in, and perhaps a little worrying to think that the very things meant to help you could also be causing problems in another area. But please, don't feel discouraged or overwhelmed. The purpose of sharing this information isn't to create fear or make you think you should stop your medications. Absolutely not. These medications are often essential for managing serious health conditions. The real power comes from knowing and understanding. When you are aware that a medication you are taking could be contributing to erectile difficulties, you can have a much more informed and productive conversation with your doctor. You can go in and say, "Doctor, I'm taking this medication for X, and I've noticed problems with erections starting around the time I started it. Could there be a connection?" This immediately gives your doctor a lead, a potential cause to investigate, rather than just attributing it to age or other general factors. The exciting part is that in many cases, when a medication is identified as the culprit, there are solutions. Your doctor might be able to switch you to a different medication within the same class that is less likely to cause sexual side effects. They might explore a different class of medication altogether that treats the same condition but through a different mechanism. Sometimes, adjusting the dose can help. In other instances, if the underlying condition is well controlled, They might evaluate if the medication is still necessary at the current dose, or even at all. And while addressing the medication is crucial, your doctor can also discuss treatments specifically for erectile dysfunction, such as oral medications, vacuum devices, or other options, which might be used in conjunction with managing your other health conditions and medications. The key message is that you are not stuck, and you are not alone in this. Many men experience medication-induced erectile dysfunction, and healthcare providers are well versed in helping navigate these challenges. Small changes in your medication regimen, guided by your doctor, can sometimes make a big difference in restoring erectile function and improving your quality of life. Remember, proactive health management is about looking at the whole picture. It's about your heart health, your mental health, your digestive health, pain management, and yes, your sexual health too. All these aspects are interconnected. Taking the time to understand how your medications might be affecting you, being observant of changes in your body, and feeling empowered to discuss these things openly with your doctor are incredibly important steps as you navigate health in your 60s and beyond. Don't let embarrassment or assumptions hold you back from having these vital conversations. Your doctor wants to help you live your healthiest, happiest, and most fulfilling life, and that includes addressing issues like erectile dysfunction that impact your well-being and relationships. So take this information, reflect on the medications you are currently taking, and make a note to discuss any concerns with your doctor at your next appointment. Even better, call their office and schedule a time specifically to talk about this if it's causing you significant distress. Thank you for watching and taking the time to learn about this important topic. Your health journey is personal, and being informed is your greatest tool. If anything in this video resonated with you, or if you have experienced something similar, I encourage you to share your thoughts or questions in the comments below. Hearing from others can be incredibly helpful and reassuring for the community. And if you found this video helpful, please give it a thumbs up. That helps others find this important information. Also, make sure to subscribe to the channel and hit the notification bell so you don't miss out on future videos aimed at helping you live your best life at every age. Remember, knowledge is power, and having open conversations with your healthcare provider is key. Take charge of your health, stay informed, and keep striving for the quality of life you deserve. Live your best life at every age.